So tonight we're going to be going over school age and we're going to be going over your adolescents. I do have a cahoots that splits up both of them, and time-wise, we should be about 25 minutes early getting out if we run the same way as I did yesterday. And that's because I don't give you this big long break in the in-between of a half an hour, which you'd prefer to go to bed earlier because you all have early morning wake ups, and I know that. So let's give you your break and do that for you and start with your PowerPoint first. Remember, this week we are doing all of the reviews for an exam next week. I've did my review. You already have it posted and available. Also, Dr. Becker has also done hers already. As you get a review, I will put it in the same announcement. You don't have to look for 7 different reviews, 7 announcements. It's one place, and I always will attach the PowerPoint, the study guide that goes along with it. So that's already posted. It's already there for you. We did discuss and questions earlier, making sure that there's growth and development, the 50 questions. If you go under pediatrics, it won't work. If you have any questions regarding that, get with me and we'll go over it again. If you by chance have sent something in and it's not correct, if you see a 0, that means go in and look at the assignment under comments, and it will tell you what I want. It doesn't mean I'm giving you a 0. It does not mean I'm going to deduct any points. It's telling you that, oops, you made a mistake. Please get growth and development done by Sunday. I give you full credit. That's one of those weird ones because it's different than what you used to have to do. It's not just pediatrics or one place. This is a different one. So anyway. So here we go. We got school age children. School age are 6 to 12. I mean, literature says 5 to 11, some says 6 to 12, but for us, it is 6 to 12. It begins with the baby teeth start to fall out now. So during school age, you're chronically having baby teeth coming out, right? And then it ends up with all the permanent teeth in by the end of school age. So 6 years, a lot of stuff goes on. During this growth, it's very slow and steady. There's no quick growth at all. I mean, that was for your infants, and we'll go into adolescence. There's a little bit there, but it's a pre-adolescent growth spurt. So as we see, height, it's 2 inches a year. But the whole height for 6 years is up to 2 feet. So you can see we could grow a lot. Weight, again, is the same, goes along with how much they are growing in height. The weight will double. So if they come into at 6 years old, they're 50 pounds. You should be about 100 pounds by they're 12 years old. And boys and girls are really not different yet. We know that they have come through learning how to walk and run and jump. And now, as preschooler, they're getting more graceful. They're not as gawky and falling over as they used to. They're using muscles better than they have because it's getting stronger. That head and the chest has nothing to do anymore. There's no looking at it. We know that the head is big at birth. We know by 1 year it should be equal to a chest. And after that, the head becomes smaller and there's no correlation. The head is bigger at birth to get that chest through the birth canal. And that's why the heads are bigger at birth and then get smaller. And we know that when we get into school age with all of these baby teeth coming out, it's that all I want for Christmas is my 2 front teeth, right? All the teeth are coming out. All the body systems are getting more efficient. The bladder, we can hold it longer. So car rides, long car trips aren't going to be as hard with a school age child because they can hold it longer. The chest, when we used to look at x-ray, the heart used to take up the whole film, it looks like. Well, now it's starting to look about where it should fit with the rest of the body. because of all the immunizations, because of all the diseases and upper respiratories and all of these things that we've gotten, our immune system is going to get really more effective and can fight disease. You're not going to be as sick as often. That the bones are beginning to ossify. Remember, I talked about an infant's head being soft and malleable, and even falling is not as hard as a deal because their heads haven't, the bones haven't ossified yet. Well, as now school age children, a good fall to the head would have a concussion and would break the cranium for sure. But that's why infants don't. It tends to absorb the shock actually of a fall. And the other thing that we don't think about is that just because a child looks older than what they are doesn't mean mentally, emotionally, they can handle older people. And I use my second grandson as this. He, at 9 years old, weighed 145 pounds and he was 5 foot tall. Big boy, right? 9 years old. Well, he wasn't 9 years old in the brain to be treated more than that. He needed to be explained things very simplistic so that he could do things. And because of the way he looked, many people didn't realize that. So they were mistaking his behaviors as something else. But again, physical maturity, as big as you are, does not relate to how they are cognitively. So be aware of that. Another thing with school age children, you've got a kid who's been great and nice and always listening and doesn't create problems in the classroom, etc. Then all of a sudden, we're seeing some disruptions going on. Or this is a child who's never needed to go to the nurse's office. All of a sudden, their tummy starts to hurt, or they feel nauseous, or they don't feel good. Be aware that sometimes children that are having stress, and it could be any sort of stress, it could be the dog is missing, or it could be grandma had to move to another town. It could be anything that creates stress in a child. Know that when you start seeing behavioral issues or physical symptoms that weren't there before, something's going on, and to find out what that child is happening. So, biological development. So, going through puberty. So usually puberty in girls start about age 10, and boys are 2 years behind. So that's about age 12. And we know 2 years after the start of puberty is when you'll start that menstruation. That's common with the girls. Now, assessing a child. Now, we're in school age. We've got a big group. We're ages 6 to 12. What you tell a 6-year-old is going to be different than a 12-year-old. I know that if I told a 6-year-old boy we're going to send him to X-ray to take an X-ray, he's going to think that it's a big radar radiation gun. It's going to shoot things out of this machinery that looks like a big robot, and it's going to zap and make holes through them. And I'm telling you, a little 6-year-old boy would think that way. So and I've seen them run out of the X-ray room, down the room, and past the parents trying to get to the driveway to the parking lot. So it has happened that their misconception of what it is. So I'll let them know that it makes loud noises. I'll let them know that they don't have to do anything. It's not going to touch them. They're not going to feel anything. But then what I do is I show them the insides of their body when they're done, whether it's a broken bone, whether it's a pneumonia, whether it's whatever. I'm going to show it to them. So now they're not afraid. Again, simple terms based on their developmental age. Now, one of the things we do with pediatrics, we always say sick appearing and well appearing. Children who are sick look sick, right? So that's the inspection. Let's just look. If they're looking sick, we need to find out what's going on. That's when you auscultate, you percuss, palpate, whatever area you want to find what's going on. We've mentioned it before, but lymph nodes, you should not feel them. If they're sick, This is your immune system. It's going to get inflamed, it's going to come into action, and it's going to try to kill whatever bug is in the body. So, lymph nodes, I'm feeling good. I shouldn't feel them at all. Now, in health assessment, you were taught to do these assessments, and one of the cranial nerves, hypoglossal nerve, is when you checked on an adult. Excuse me. With a child, in fact, I just got off doing a Zoom meeting. My grandson, my youngest and probably my last one, is 6 months old, and he looks at me, and the first thing he does is this, and he sticks his tongue out, and he's been doing that for a couple months now. It's like our little thing that we have. So even a little infant can be tested for their hypoglossal nerve, because my little Benji does it. So any little infant, if given that opportunity and shown what, they're going to do it. Another thing about breath sounds in children, breath sounds have a lot of upper airway mucus, especially their nose, because they can't blow it all out, right? So they tend to have it dripping in their nose going on. So if you're listening to breath sounds, if you're listening above the clavicles, this is all upper airway. In fact, I've come into the habit when I'm listening to breath sounds. First, I'll listen to upper airway, see what mucus is there, and then I'll listen to the lower airway, which is the breath sounds, which is what I want to see. Is it a pneumonia with decreased breath sounds, or is it asthma with expiratory wheezing like crazy? Okay, so that's lower. These upper airways sound like bronchi in the lungs. So you've got to be aware of it. If the kid is able enough, or you can suction that nose, etc., to get it clean, you might get a good listen to what really those breath sounds could be. So this exam, the hardest part is your theorists. So let's review Freud. Freud is everything about sex. But with school age children, it's a latency. So this is the only of all of the stages that has a word that you're like, gee, which one is it? So you have to remember the word latency. And all it says is that as school age children, they develop what we call same sex peers, which is your friends are going to be, if I'm a girl, they're going to be girls. If I'm a boy, they're going to be boys. And this is that first psychosocial, or finding out about another person, and then you start to learn about the other person and cultures, and all different things that they do differently, because we're all unique and we're all special in our own way, right? Erickson, how we deal with people around us. Erickson, psychosocial, people around us. What does Erickson say about his school age child? Well, it's an industry versus inferiority. Oh my, what does this mean? Well, if you think of an industry as a factory, a product, something that you make that's good, and you feel great about it, and other people tell you they're so proud of you, you play that piano well, or oh, you run fast, or wow, your spelling is amazing, oh, that school age child's going to feel great. But what if that child can't run fast and somebody's saying, hey, come on, you're slow, you're going to make us lose, come on, catch it up? Well, the child, not everybody runs fast. I'm a slow runner, to tell you the truth, but this poor child can't run fast. Now, the school age child feels inferior, because can you do everything well? No. So what you feel good about, that's your industry. I feel great about. What I can't do, because you can't do everything, I feel inferior about. Now, one thing that is said about Erickson in the school age area, if we have a child in a hospital prolonged periods of time, and we need to give them things to do to keep them interested, whether it's a puzzle, whether it's drawing a picture, or doing something, whatever task you give that child, make sure that It's going to take a little effort to do it, but don't ever give them something that they would be unable to finish or accomplish. For instance, would you give a 6-year-old a 1,000-piece puzzle to do? That's a sunset, which is all the same colors. Oh, absolutely not. You would give them maybe 100, 200 piece, smaller, but with different variations. So again, they're able to do it. It takes a little effort, but they're able to finish it. A sense of accomplishment. Again, inferiority, we've already discussed that. What I can't do. Now, Piaget. Piaget is all about thinking. So remember, an infant grabbed mommy's finger, and then they ended up reflex grabbing a rattle. And then as it was in the hand, it made a noise, and oh, I like that. So next time when they not a reflex, but voluntary, grab that rattle, I moved it because I like that noise, but then it fell into my mouth. And I like that even better. As we get older, we could even take that rattle like a sippy cup, throw it on the floor, because we know mommy's going to come pick it up because I've learned that. Cognition. Well, what is school age in relation to understanding things? Well, masters of conservation is what Piaget says. And what that means is if you have the same thing, whether liquid or solid, whether it's in a short cup, a tall cup, or clay, which is in a ball or flat, or 10 pennies disorganized or organized up, it's still the same. That's what Piaget says, that they understand those relationships. They can build their closet, all short sleeve shirts, all long sleeve shirts, all red shirts, all this, all that. They understand putting things together. This is just that explanation of same things, different, but it's still the same, and that's school age. Now, children that are with Eric with Piaget, we have formal operations and concrete operations. And you're saying, what's the difference with Piaget? Well, Piaget, we know if we've built something in children, we can take it from taking a rattle and now we're throwing it on the floor. Mommy's coming and getting me because we've built all that stuff. That is concrete because concrete means you can taste it, touch it, smell it. You've known it, you've seen it before, you can replicate it. Formal operations, nobody showed you ever how to take care of it, but critical thinking skills hit. And now, as I say, these adolescents, because that's the older school age adolescents, they can fight their way out of a paper bag. If they want to go out on Friday night and mommy already said no, well, that teenager's going to go make his bed, take out the garbage, get an A on another test, wash mommy's car for her. They'll do anything. They have tried to figure out what can I do to get what I want. And that is, I now am thinking that Piaget, that is the last step in the adolescence. Now, moral development. So it's all about right and wrong, right? You know, we have id, ego, superego, right? Kohlberg, when we talk about it, there's right and wrong. Infants and toddlers don't know right or wrong yet, okay? So when we talk about moral development, it starts with preschoolers. What do preschoolers know about right and wrong? They know reward and punishment. They know if I do something right, I'm going to get something, right? Or I'm going to do wrong, I'm going to be punished for it. So they're starting to understand it. Now, when we get up to school age and Kohlberg, they just want to please people. Their morality is, I'm going to do everything right because I want to please people. That's Kohlberg, school age. Now, spiritual development, they still really just know what the family has given them. They're also thinking things as school ager, and I've seen this where they were hurt, whether they broke their arm. I've seen it actually a lot with they need to have their appendix removed. They come in with that right lower quadrant and they're getting ready for surgery and they're scared because God is punishing them because they hit their sister yesterday or did something wrong, because they feel that if they've done something wrong, they're going to be punished and God's going to punish them. And that's what spirituality at this age is thinking. So, social development is peers, right? And peer groups. And we know that if one peer doesn't want to go in Girl Scouts, but wants to go into 4 H or something else, if that peer is close enough and that bond is close enough, you'll have a peer changing, ideas. Well, all right, you want to do that? Okay, I'll go with you, because it's that strong influence of peers. The thing with these social groups and whatnot, there is a lot of bullying, I did this better than you did type stuff. And that's anywhere, school, even playing, in the neighborhood. It's all going to happen. But to be aware of it, to teach our parents, to make sure that, there is possibility and to be there to answer questions and to help them if that does go on. Remember, as we get out into these groups, there's going to be other adults running these groups. So not only now do you have your school teachers, probably your Sunday school teacher, and now you have the 4-H, the Girl Scout teacher, are going to inflict their opinions on your child too. So again, it's somebody else there trying to groom them, help them, make them feel good about themselves. Parents at this age, I mean, we want to be our child's friends, right? That's what all parents will ever say. But we need to be a parent. And when it's right, it's right. It's wrong, it's wrong, and they need to be taught those things. So play is going to happen forever. I mean, my 92-year-old mother, my husband's mother, still plays her game on her little phone every day, right? It's just what people do. It plays, occupies the time. Why do we promote that with school age children? Play. Well, what is life? Well, life is a game with rules and rituals. And there's individual play and team play. And all of these things get you to the goal that you want to do, right? So it's actually preparing a child for the future. So as we grow older in school age, you're starting to know differences, whether it's abilities, you run faster, you're better at math, or, maybe it has to do with way they're dressed, even the colors of their eyes is a big, big thing that's going on with, again, the body image also. They're aware that they are different from other children. And they're asking questions regarding that, and we should answer them. As a 5, 6-year-old child, they're going right into school now. So before this, what did we have? We had preschool, right? Preschool is shorter periods of time. It's more fun. It's less lesson. So it's not that difficult to fit into that. Well, now we're getting into kindergarten. And it is where they have to sit for periods of time, they have to listen, they have to follow directions. Having a friend there, that peer relationship, is really important because they can talk their frustrations of what's going on around them together, which is a great thing. Another thing, as we're getting more time at school, you have other people now, children having more time with your child too. So again, it's learning other people, other cultures. Nutrition. Now, do you think nutrition is important in a school age child? Well, they're still growing. they still need to learn more, right? So, yes, it is very important. In fact, we take it to another level with school age children. We know that this is the one of the best age to teach, that they're receptive, they're open-minded, they haven't formed opinions yet. So let's teach them all about what is proper nutrition. We know that there is today a lot of fast food for dinner because mom and dad are busy. At least they're getting dinner, right? And then there is a program that we teach our children. It's called My Plate. And it shows the carbohydrates and proteins and breads and dairies and what you should be eating in a normal day. And we know it's difficult to get all that good stuff because it costs a lot of money. Now, school age children have the possibility to be obese, and we've seen it more than ever. So it's reaching epidemic proportions. I mean, children are staying inside today where they used to go out. They're playing with computers and video games and their phones, or they can't go out because their neighborhoods are not a good neighborhood. We know that if we don't start teaching our children all about overweight and all of the possibilities as a future overweight child where it could become, they need to know now. Possibilities of diabetes is big, overweight young child, hypertension, high cholesterol, and all of these things could have been stopped early with education of obesity to these children. So it is a great age to teach. Teaching nutrition should start actually with the pregnant mother, and it should be straight through from birth all the way up, even before birth. Obesity, it's all ethnic groups. It doesn't matter. I mean, everybody has that possibility, right? And we know one of the things that we've heard with children is my mom makes me finish all my food or I can't get up. So I've learned all my life to finish my food. And now I'm overweight and now I can't finish my food. And it's a problem because that's what caused it. So what they're recommending is that children should not have to be made to finish their food. Sleep during school age, they're sleeping good. We know the 6-year-olds are going to have bedtime issues. They're younger. And then, of course, after like 8, 9, it's like it's time they go to bed. They don't care anymore. We've talked about sports, and we know that the problem is that emotional maturity with competition. They don't recommend early school age children to be in organized sports because of the concerns with that emotional maturity that goes along with that physical, okay? Dental health. We know that all the baby teeth are coming out, right? And then all the permanent teeth are coming in. So we really need to take care of those teeth. So they need to brush their teeth and they need to floss. Now, the problem with younger school age children is they don't have that manual dexterity. So they need help with it, but it does help with preventing cavities. Is losing teeth a sign of poor dental care? Well, if it's a baby tooth, no, because you're supposed to lose them, right? But if it's permanent teeth, yes, it is a problem with poor dental care. One of the things that I've seen quite a few of is where children, and it's usually on a monkey bar or in a swimming pool, where they come up and they hit their chin and their teeth hit and the front tooth goes flying and the tooth is out. How do you save that tooth, especially if it's a permanent tooth? So, what they recommend is put it in cold milk, or even saline actually works, but cold milk. And it gets it and saves it so that a dentist can take and put numbing cream on the area, get it good and numb, and then they push it up in there. They call the dentist from the emergency room, and then he comes in to do it. Sex education. Excuse me. Sex education is really important with the school age children because they're starting to see and hear more, TV and everything. They're starting to be, seeing it around them. So again, answering questions. Um, we know that their understanding is different from ours. So we always say, have them tell you what they know first before you start, telling them that what you think they want to know. Because sometimes it's very easy what they want to know, and we make it very complicated. As a nurse, sex is normal. So questions and answers, trying to answer them as easy as possible, making them feel comfortable with it. You know, One of the things we could recommend is that they talk with their parents, but the other person is a school nurse. School nurses are good for this. School nurses work with a lot of things. Actually, it's a great job. If you have young kids, you'll be off all the holidays with your children. So I think it's a good position to have. They worked a lot with things that for instance, COVID came out, they were on the front line, right? Figuring out what to do, how to do it, when to put the children home, when they stayed home, etc. They also work with, if you get a bacterial meningitis, they will send out a flyer to students that were around that child to make sure that they get prophylactic treatment. Injury prevention in any age child starts with motor vehicle, always motor vehicle. The risk factor increases for injury when you have something going on at home. That's a part of getting abdominal pain that's acting out. Now, also, they tend to get their mind isn't working as well as they could, and they can do risky things just because they don't think properly. So, again, that would be a child you look at their home. They should be in the rear vehicle till they're 13 years old, in a booster till they're 8, and ATVs are not recommended for children under 16. I live in Homestead, Florida, which is by the Everglades, and ATVs are always running down the street, and I see young kids on it. And it scares me because there's no cell phone service out there. So, again, I think it has to do with safety. Remember, anything is always safety with bicycles, any sports, always remember to promote safety equipment. As a school age child, they're becoming, as I said, they're going to school, they're spending more time away, they're getting their same sex peers, and they're very slowly finding other understandings of cultural, spirituality, other people's, other thoughts. And again, parents should be involved in it, but I like this unobtrusively as possible. I mean, you want to know everything that's going on, but you need to give the child a little space, and let them try to figure out the best ways. Because remember, they're pleasers. One of the conditions we see in school age is ADHD, attention deficit hyperactivity disorder. This is something that is diagnosed with a child who is inattentive, hyperactive, and can't finish anything. It's at home, it's at school, it's everywhere. And usually, what happens, these children get so hyperactive and they can't control themselves. Usually, the teacher will send them to the nurse, the school nurse. And then the school nurse brings in the parents. Now, my best friend, or she was my boss at work, so she's a nurse too, had a son who was ADHD. And the first time she went into the office, the school nurse said that she had to stop spoiling her child. And when she was telling me this, I was okay. She said that he needed more discipline at home. You let him do too much, or blah, blah, blah. Well, If she knew everything that she had done to help this child, she wouldn't be saying those things. So again, the point here is parents, can express themselves. Let them know what they've done. Be quiet, give them that time. And then together make a plan of care. Don't say, well, he's hyperactive. He must be spoiled. You're not doing anything, which is sometimes what, parents hear. I know my friend did. Enuresis, this is urinating at nighttime. It could be all the time, it could be intermittent, and it could be due to a reason, right? It could be um, that they need some sort of psycho evaluation. It could be those things or medications. But if you're a child who's never urinated in the bed at night, and all of a sudden you're urinating, there's a problem. Is it diabetes insipidus? Diabetes mellitus? Is it a urinary tract infection? So again, you need to evaluate it. And if they're always been urinating, again, we got to figure out, is it that we need that behavior modification? What do we need, or medication? So enuresis, urinating at night, whether they've done it before or not. Acoparesis is basically constipation, and then a little bit of liquid comes around that big constipation, and it drains and it leaks. And it's the thing with constipation and children is children can control their bowels. And I've actually seen children hold it for a week or two. Actually, 10 days was the longest. And the whole bowel on the x ray, it was definitely stool. Again, what do we do to treat this? If it's because they're controlling it, they're going to need behavioral modification of some sort. And of course, always diet, increasing liquids. If they need medicines, they do not like to give enemas on these children. Once to get it going, but nothing after that. And, Miralax would be the strongest of anything they want to use, because if they need to use something for hard stools now and they're little 2, 3-year-old children, what's going to happen when they're 80? So you're going to need dynamite at that point. So a child has an avulsed, knocked out tooth. The parents are reluctant to try to implant the tooth. Where should the tooth be placed for transport?
The A?
Yes, it should be in cold milk. They also say saline if you have saline, but yes, cold milk. So, all right, let's start our first one. And let's go to our first cohorts. Who wants to win the first cohort? School age. Sarah, do you want to win? Julia? Helen? Haley? Anybody? Nobody? You're that tired today? Come on, guys. Give me a little pep. All right, let's get going. Week 3 already, school aged. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning does what? Remember, infants and toddlers don't have moral reasoning. I mean, toddlers have id, which is id, ego, superego. The id means I want it, I, me, mine. So before that, it's not anything. Now, when we get to preschooler, they understand right and wrong and a consequence for each, or we call it reward and punishment. In school age children, we try to please others. In which of Erickson's stages do children to begin conservation? So conservation is concrete operational. It's because they have seen it, understood it before, and they can replicate it. The conservation has to do with the liquids in a tall glass or a short glass or a big clay or that clay smushed down. They had to see it to understand it, and that's the conservation. According to Erickson, industry versus inferiority begins at age what? So that's school age children, and it's 6 to 12. Multi. Erickson's industry versus inferiority. We mean Erickson. Psychosocial, working with others. Erickson. What do I do well? That's all about my competence, what I do well. I'm competent in that. Also, I'm confident in what I can do and my abilities. Absolutely. That's what I do well, and other people are telling me about it, which is a common sign of stress in school age children. So again, any type of medical stuff that's keeping coming up, or behavior changing, or increase in accident prone stuff, all of that stuff is a sign of stress in children. A multi. What are signs of stress in school age children that need to be investigated? So when we're talking about stress, right, we know bedwetting could be due to stress, but is it also due to other medical problems? Yes, diabetes insipidus, diabetes mellitus, urinary tract infection, and stress is part of it, but you've got to rule out the physical reasons too. And a regression to the earlier behavior. This is telling you all of a sudden the child um, starting to suck their thumb, or needing that device, that blankie that they have to have that gives them that comfort. This is that regression. What is so bad they're going there? Again, trying to help the child work through the stress. Multi. Safety education for the school age child might include school age children. I tell you, they're the best teachers, right? So, what are you going to teach them? They are our best learners, our best students. Everything: bicycle, water, motor vehicle, firearm, all of those things they will be talking to. Even the lock key kids, where they're coming home and nobody's there. Again, safety education. Keep the kids safe. Dental care typically begins about what age? So you start to get a tooth about one. So you're going to be doing dental care as soon as the tooth comes up. What dental care do we do initially? Toothbrush, no toothpaste, and we can include fluoride at 6 months. So by 1 year, that's usually when the teeth all come in. Yes, just that toothbrush, no toothpaste. According to Erickson, trust is to blank as identity is to what? You need to know the names of Erickson. If I'm trusting, I'm an infant. I trust you're going to bring me something to drink and change my diaper. And identity is all about adolescence. Who am I? What am I going to be? My role? What is going to be when I grow up? And then, of course, who do I want to fit in with? How does the onset of pubertal growth spurt compare in girls and boys? Who starts first? Who comes next? We know girls start about age 10 and boys about age 12. So it's earlier in girls. What age appropriate activities will be included in the teaching for a 6-year-old child? So, jumping rope is a really good thing for about a 6-year-old child. Large jigsaw puzzles, yeah, it was appropriate. They can do them as long as there's a little bit of you know, challenge to it. Remember, competitive sports. We've got to be careful because of all what could be going on behind the bullying. As long as there are a parental or some elderly, somebody there to help them during it. But we don't recommend them as early as 6. How is chickenpox spread? So you get a child who comes into the emergency room and you're that ER nurse and they've got a rash all over and they're oozy and juicy and they got a fever and they itch and they don't feel good. What's the first thing you're going to do? And you're going to put on a N95 mask first. Then you're going to take the child, put them in a reverse flow room so that we don't get chickenpox everywhere because it is airborne. Okay. And even if you've had an immunization, does not mean you're not going to get it, because I've seen children who's gotten the immunization who get chickenpox. So yes, you can. A multi. At what point is a child with chickenpox not considered dangerous? This is one question that you get from parents. It's like, when can I send this child back to school? So, no new eruptions, no fever 24 hours, and all of the lesions are crusted over. That is the big three that they look for. Itching is not what they say as long as they're crusted. Which age group characteristically plays with the same sex peers? And that is school age. It's exactly what it said. Same sex peers, 6 to 12, school age. Culturally competent care includes. I've talked about religion and spirituality and what I believe and your possible your child or parents can believe. What do you do with that? So when we know what's going on, we are going to incorporate it in the plan of care. It could be respecting a vegetarian diet or respecting time to pray at this time, this time, this time, or, allowing this at this time. Again, this gets that patient. They're mentally, they're feeling better because they're doing all their own practices. And I've seen things happen where they're praying their way and the patient believes it, and I've seen patients turn around and get well like the next day. You're like, what happened? I'm talking that type of improvement. So you would always put their culture into the care as long as it doesn't interfere with medical care. Flossing daily is recommended for good dental health. Yes or no? How many of you floss every day? And absolutely you should. A 6-year-old needs to get a chest x-ray. What explanation is the best? We have gamma radiation rays that could come out and zap you and take a picture. You'd be surprised what some children tell you about that big machine in x-rays. It's just basically there's a camera. I'm going to take a picture. It's not going to hurt you. You don't even feel it. Care for a knocked out tooth. What do you do? So put it in milk or saline and get somewhere where they can put it in. If you have a pediatric ER, of course, that's the best. Many of them do have dentists 24 hours. So again, get the tooth replaced. And if it's a permanent tooth, the mother to get it put in and not have to do any other treatment, that's what you want because they are expensive. Dental care. Which thought process involves logical thinking for school age child based on the developmental theorists? Thinking, logical thinking. What do school age know? Thinking is who? Piaget. What does Piaget say? And it's concrete operations, right? Logical thinking, which means concrete. I can see it, feel it, touch it, smell it. I've seen it before. Okay, I can figure that out. Remember, formal operations, there is complete critical thinking. There is, you've never seen it before. And that is, again, adolescence, a little bit older. A multi. Erickson's school age. Let's put it all in one place and tell you all of them. A little bit of everything. So again, school age, industry versus inferiority. I do something well, I feel a sense of accomplishment and I feel good about that. But I can't do everything well. And people and these children should know that not everybody can do everything, but still the child will have that sense of inferiority because children want to do everything. They want to know how to do it all. According to Kohlberg's conventional morality, school age children believe what? So we start out with toddlers and infants, and they don't have a morality. They're an id. It's about me. And then we go up to preschoolers, and what do we believe? And as we get to be school age children, so morality, right and wrong, right? As school age children, they gotta follow the rules because that's the right thing to do. So they want to people please. They want that. So they're gonna follow the rules. Younger kids, reward, punishment, consequence for right or wrong. Anorexia nervosa. I put this here as one of the eating disorders. It could be school age, it could be adolescent. But what is it? Because I mean, as we are doing our evaluations, we'll see a skinny child underweight or, an obese one, and there's reasons for it. So if it's an anorexia nervosa, they need some sort of behavioral therapy, don't they, in order to help them with it. Anorexia nervosa is when they're even afraid to drink water. A leaf of lettuce is too much calories on them and they starve themselves. They also overexercise to burn off that 2 calories they ate with that glass of water, they think. So that's anorexia nervosa. Which signs may indicate that someone is struggling with bulimia? Now, this is the other eating disorder. And with bulimia, it's different than anorexia nervosa, although they're both thin children. With bulimia, these children eat an unbelievable amount of food. And as they're eating, they're vomiting. So they don't want it to absorb, but they want to eat it. So they're running constantly to the bathroom, constantly. Now, how would you, if you were looking at a child and you didn't know anorexia nervosa or bulimia, how could you figure out what were they? Well, if you're vomiting stomach acid. What are your teeth going to look like? Probably they're going to have cavities because of the stomach acid that's gone up. That's usually the way we figure out which one. Which of the following could be a sign of potential child abuse or neglect? So, abuse and looking at injuries, it's looking at the injury and what they say caused that injury. And if there's some disconnect, you need to think about it. You need to protect the child. Cooperative play. Remember, there's three sort of plays, and you need to know which one is which. You've got parallel play, toddlers, right? That's next to each other, not sharing. And then you have associative play and cooperative play. Cooperative play, there's a goal in the end, and they're older children. Those are your school age children. So two or more children playing together with a goal, whether it's building a castle, building a train set, or playing checkers and winning. That's cooperative play. That's school age. And remember, associative is preschooler. They're playing together, but there's no goal. What type of play is considered cooperative play? Well, what's the definition of cooperative play? Two or more children playing together with a goal. Which one is that? Somebody wins. There's an outcome, and playing checkers is it. Absolutely. They won. They played checkers. And last question. What two common sign symptoms can be found in children that have ADHD? And that's the inattentivity that they do get, and it's just part they're running in circles. I'm starting here, and they never finish anything. So number three, Leandra, good job. Number two, Sarah, good job, Sarah. And who did it today? Number one, Camis. Good job, Camis. And then JJ and JK. All right, what we're going to do now is our adolescents. And I've got a shorter cahoots after that, which I'm sure you'll all be happy with that. All right, any questions about anything so far? I've not lost you yet. All right. So here we go, adolescence. I call adolescents, hold on for the ride of the roller coaster. The children are going through, I'm a child, and now they want to be able to do whatever they want, when they want. And here, can I have 20 bucks, mom? And I don't know if 20 bucks is enough to go anywhere today. So maybe they're asking for 50 bucks. I don't even know. My children are older. Thank you. So, adolescent child, they were a child and now they're growing up and they're getting ready to be an adult, aren't they? It is rapid physical, cognitive, social, emotional maturation. Remember, as they come in as a school age child, now they've started puberty, all of their permanent teeth are in, they are starting to grow up and be now almost adults. We know that the adolescent starts with the appearance of those secondary sex characteristics, either the nipple buds or, an enlarged scrotum, male and female, and it ends when they're grown about 18 to 20. So in girls, first change that we see is the breast buds. We start seeing them, and the nipples, we start seeing them getting larger. In boys, it's testicular enlargement. So that's the beginning. And it's usually about 2 years that we see them go through this until the point where they start menstruation. And that's about 2 years after puberty, as I said. Boys and girls both should be getting that 3-dose series of HPV vaccine preventing cervical cancer in women. So I have the chart on tanners. I put it here because I've started to see it referred to on HESIs. And they're asking you at what stage tanners would you see in a girl or a boy? So I came and I looked at it trying to help y'all figure out how do you remember this big stage and all of it. Well, if you look at it, stage one is a child. Stage 5 is the full-grown adult male or female. So you only have stages 2, 3, and 4 to think about what stage this could be. And we know what stage 1 is already. It's the beginning. So it's the breast bud for girls, it's enlarged scrotum for boys. So when we're looking at possibilities of what could be the answer to it, you only have a choice of two. Is it now we're seeing a hair? Are we now seeing the height? I mean, there's different things. Again, that's Tanner's, and it does look at, menstruation and puberty and where are you in that chain. So I've mentioned that pre-adolescent growth spurt. It usually happens in the beginning of adolescence and it goes on for 24 to 36 months. It's still quite a big growth spurt because remember, since we were infants, we've not grown that much. It's slow and steady, right? Well, at the beginning of adolescence, it's this big spurt. So they go from looking like little children, and all of a sudden, over the summer, they look like full grown adults. I see that between eighth and ninth grade with all my children and even with my children's friends, et cetera, et cetera. There is just a big difference that I see. We know that that pre-adolescent growth spurt is a time where those children need good nutrition. And we know adolescents now have body image issues, and now they're too fat, there are too many pimples or too many. So they're going to be watching diet and probably not eating much or less anyway. So when we talk adolescence, it's all about identity. Who is identity? It's who am I? What am I going to be? What group do I want to hang with? What is my outcome from life? Am I going to be preparing for college? Or am I preparing for what? What am I going to be? Also, this body image can create a lot of depression. What if you're too fat, too skinny, too many pimples, hair's too curly? I don't like my eyes. I don't like, and all of those things. It's all about body, and it can cause a severe depression. Remember, suicide in adolescence is a big possibility because of all of these changes they're going through with themselves and they don't like what they're seeing. So suicide is big. So if we start seeing any changes in sleep or eating or talking about this stuff, take it seriously. We know adolescents really want to be their own little people. We call that identify themselves. They want to get independent from their parents, authority. They want to do what they want when they want, but they don't want the responsibility attached to it. And that's adolescence, right? So again, they need to be accepted by their peers. They're worried about body image. Parents now, their roles are now changing. So yes, we've gone from as parents protecting, but now we sort of have to understand these changes these children are going through, but they still need to have control over that child and try to work on some sort of responsibilities together. It is suggested that with a other person, school nurses are the great person for this, sit down and try to make what their boundaries are, what is expected and what I want, and try to work with these parents. Some adolescents are pretty rough to work with. Peers, of course, will always be a big thing with children of all ages. It doesn't matter. Best friends, they say, are that person. How you treat that best friend as an adolescent is how you are going to treat your partner of life. So if you treat them well, you're going to have the partner's going to be very happy with you. Teaching and talking with adolescents can be hard. Trying to build up that rapport can be difficult. So sometimes it's just you have earpieces in and they're listening to music and what music you listening to? Or maybe they have on, a New York Yankees baseball hat. It could be that break open thing. Oh, you like the Yankees, or you from New York, or trying to make up something. Sometimes just breaking that little silence can help. Another thing is a lot of times children, adolescents can't speak to their parents about things like sex, right? So we're not going to be talking to those things about sex with them. So they got to go somewhere. So school nurse is a great one. So is if you're a nurse in a doctor's office or some sort of urgent care, whatever. So one of the things about talking with these children is to sometimes you've got to have the parents out of the room. You can talk to them, and a lot of times, they're gonna. You need to ask questions regarding sexual activity. It could be that you've had urinary tract infections or something's going on. You can ask the parents to leave the room, and you can talk freely with that child, and you don't have to tell the parents what they said unless it's going to hurt themselves or others. Okay, you can be that there for that child, and listen to them. Also, if they want information about birth control, yes, without parents' authorization or permission, consent, you don't need it. You can give them oral and written information and not your opinion. Okay. As I said, immunizations, that 3-shot HPV is good. I've already mentioned that nutrition, they don't eat the way they should. That's why they're going to be lack of some vitamins. So watching that body weight, if it's up too high, too low, in order, looking at it, making sure that if we need vitamins or what do we need? And how do we evaluate, eating behaviors? Again, it's a 24-hour diary. That is the best thing. Or what did you eat yesterday? It's giving me an idea. What have you been eating? And we can see it pretty quick. As I said, adolescents, they go through all of this growth spurts. They're tired, you know, uh, they have all of this work to do for school. They want to get in that good college. And then, we got a new boyfriend. So now we're on the phone and texting all night long and we're not sleeping. And again, this is part of they need the rest, but they're not getting. And that's the reason, whether it's schoolwork or, their personal relationships. We should have them exercise more than they do. They don't. Again, making sure dental health and flossing. Sexuality, again, I've talked about it, and yes, we can give them information. Safety, injury. Well, children, all of them. What's number one? Any age? Motor vehicle injuries. That's always going to be number one. Now we've got adolescents driving the car. So now I'm really scared, aren't I? Yes, firearms will be there because now they feel they can pick them up and use them, and they don't understand the safety on these guns and how to use them properly. Sports injuries, they're trying to be the best they could be to get that best scholarship, right? So they tend to not do that warm up or this or that because they're trying so hard. And our goal as health professionals is to teach safety and injury prevention. So, Matt, he seems to always be eating, and his weight's appropriate for his height. The best explanation for this is what? What happens in the beginning of adolescence? It's that growth spurt, right? 20-25%. So, is it normal that he's going to eat more if he's in a growth spurt? Absolutely normal because he's getting taller and he's getting bigger. So let's go with our other coat. Any questions? The what? I grabbed some more water. My throat is very dry today. I'm a little scratchy voice. And here we go. Rheumatoid arthritis. There's a joint in your voice box, and that's what happens when it gets inflamed. I get a scratchy voice. Erickson identity versus role confusion. What's that? So identity is all about an adolescent. So again, you need to know the names of all of the different theorists in the different areas, infant, toddler, preschool, and that's going to help you. There's quite a few theorist questions. This is when adolescents need to establish their own identity and to form values to live with. Adolescence. And that is identity versus role confusion. It was right in the question. Absolutely. They want to know, who am I and what I'm going to be when I grow up and where do I fit in? In the identity versus role confusion stage, adolescence. So at this point, adolescents are looking for their self and their identity. Yes, they are. What age do you have to be to drive an ATV? So to drive an ATV, our book says it's 16. And the reason why it's 16, I mean, 18 would be a great number, I think, but they say 16 is they have to have the mental capacity to be able to figure out if they got into a bad issue. As I said earlier, I live in an area where they go out into the Everglades and there's no way of getting hold of anybody. No one lives out there. There are just these roads and they just take the ATVs and go. And in the Everglades, there's all sorts of wild animals and alligators and crocodiles and snakes and I don't know what. So they have to be alert enough to understand what to do. Since surviving a sexual assault, she startles easily, feels numb emotionally, and has flashbacks. Her symptoms resemble what? The one thing that we tend to forget when we have any sort of patient that has been attacked sexually, it doesn't matter, male, female, young, old, doesn't matter. Remember, the person who brought them into with them is also suffering if they brought them in to say, hey, they've been sexually assaulted, and they also are going to feel this post-traumatic stress disorder, and it is a real thing. Many victims experience emotional and blank reactions from rape and sexual assault. So I think this has said it very well. Knowing it's just overall, it's not just the physical part. We have to worry about the mental, and of course, the person who also brings them in. That person is going through suffering too. Which of the following are false about HPV vaccination series? So it is either 2 or 3 injections. What they say is that adolescents that are younger than, I say that the 12-year-old that we're giving them first, they only need 2 injections. They say after 15, they need three. But again, it's going to be a physician's choice, but know that it's either 2 or 3. We call it a 3 series HPV. At what age should a parent expect to have major conflicts over independence and control with their child? They want all the privileges and no responsibilities. I'm old enough, I can be out till 2 a.m., right? That's an adolescent. I know better. I would never have said that to my mother. And that's at that mid, okay? So they've gone through that pre-adolescent growth spurt. They've gotten taller. They've gone through the puberty. Now they're getting hair on their chins or breasts, and they're becoming more adult female and male appearing. And they want to go out and enjoy themselves. They feel that they look old enough. They want to go out and act their age at that point. But again, this is a frustrating time, parents and for the children. Again, you might need that mediator in there. What Tanner stage marks the onset of puberty in most males? So the beginning of the onset of puberty in males is the scrotal testicle enlargement. And then the skin gets changes of texture and color, yes, but it's the testicular enlargement. What marks the onset of puberty in girls? And that is your menarche, and that's the onset of puberty. Where does it start with? Breast buds, right? What is the Tanner scale used for? This is a scale actually adolescent medicine likes to use a lot, in the pediatric world. And it just measures puberty, sexual maturation. Are you where you should be? Are the things happening that's supposed to be happening as you go through puberty? Major cause of death and injuries in adolescence is Death and injury and adolescents and school age and infants and any age child is motor vehicle, automobiles. Very good. True or false? Sex education for adolescents aims to provide information to adolescents about issues related to sex. Can you do it? Can you give an adolescent information? Do you need mommy to say you can? And it's absolutely true. And you don't need a parent to give you permission. If an adolescent asks a directed question, you can provide oral and written information. How can you get an adolescent to be more receptive about talking about their health and sexual exploration? So again, adolescence, I mean, if it was me and the nurse said the parents get out, I would talk to a nurse. I would absolutely be, I would be so scared to talk in front of my mother or my father. It's just something you didn't do. I had six brothers, so I was the only girl in the house. So getting the parents out, you can sit there and talk with that adolescent, and help them, giving them the information that they do need. And of course, telling them they should speak with their parents. And if they can't, at least speak to the school nurse. At least you've done something to help them once they leave you. True or false? Keeping a food diary is the first step of treatment for an obese child. And that's absolutely true. Remember, any age child from infant to, adolescence, we're seeing problems with too much food, not enough food, or we're seeing cognitive problems. Again, first thing is, what are they eating? And then we can make changes from there. And part of it, do we offer food as rewards? Yeah, we can. But we're not going to offer nutritional foods like carrots. I mean, that wouldn't be something, but maybe they can have a little scoop of sherbet on a Sunday or something, whatever their favorite thing might be, right? Last question, a multi. So, an adolescent's been brought into the ER with a drug overdose. What is the initial questions you need to ask? You're doing an assessment on a adolescent with a drug overdose. What do you need to know? What do you need to ask? So we don't know about rehab yet. This is way too early. But when you're in the ER and you've got a child, any patient that's having an overdose, you need to know, what did you take? When did you take it? And how did you give it to themselves? We know that IV is going to go away quicker. If we took it orally, it might be lasting longer in the body. So knowing the route of administration is a big, big deal. And of course, what type and when, of course, that's self-explanatory. Leandra, good job. Number three. Number two, Sarah. Good job, Sarah. Number one, Cammy's did it through. Good job, Cammy's. And we got Queenie and Christine came up. Good job, guys. Well, I've got about 10 more minutes. I got to keep you so my boss doesn't yell at me. And what I decided what I wanted to do with you all, I'm going to be doing a quick math review. I think that there's two sorts of questions that you all tend to get upset or worried about, don't know what to do with. So Did you all see that I gave you a math document? And that math document says that it's exam one questions and there's 10 of them. In those 10 questions, what I have done is I have taken the questions from the exams, made up different numbers, different way of saying it, but it's the same type of questions. If you can do the questions on that worksheet, you know to do the math that you're going to be getting on your exam. Okay. Now, anybody who doesn't know math that really needs help, I can make it understandable. Now, I don't do ratio, proportion, and all of that. Add it up, cross it off. It's not what I do. But I will show it to you what I do today because it's also how to pick numbers out of a problem. All right, so it's about 10 minutes and then I'll let you all go. So let's look at now. The one thing that I've taught students who come to me for tutoring about math is the first thing you've got to do is figure out what sort of problem, what sort of formula do I need to use? So we have only two that I use in this course. One of them is that dose over what do I have available times the quantity it comes in, the DHQ question, as I call it. The other one is mLs per hour. And that question, when you're looking at it, because a lot of them look like they're mLs, like this is going to be the formula for everything, but it's not. When it's mLs per hour, you need to have time and quantity to be infused. If you don't have time and quantity to be infused, it's not mLs per hour. All right, let's do number 5 because it looks sort of wonky with a whole bunch of different stuff. So I'm going to talk it out loud on how to solve this. All right. So a healthcare provider prescribes. Whenever I see the word prescribed, order, deliver, give it now, this is a doctor's dose that needs to be delivered. So it's medicine. It's going to be 37 milligrams. I'm writing this down so I don't forget. So 37 milligrams, I'm going to give it every 6 to 8 hours as needed. The medication label says, so this said I'm giving a dose. This is a DHQ question. Prescribed, order, deliver, I need to give. So it's 37 milligrams. What do I have on hand? I have 25 milligrams, and that came in 2.2 mLs. The nurse prepares to administer one dose. How many mLs will the nurse prepare to administer this one dose? Record your answer using 2 decimal points or places. All right. I'm going to put it up on a screen for you. Okay, so we have 37 milligrams is what my dose is. What do I have on hand? I have 25 milligrams. And that was in 2.2 mLs. Now, if you notice, I put it over 1. I keep everything straight. Now, one of the things that I want you to get accustomed to doing as you're doing the problem, milligrams over milligrams equals 1s. So get that label away. So the only label left is mLs. So you know you're answering the question, how many mLs to deliver, because that's your only label left. So mLs will be the answer. The other thing I do is I multiply the top numbers, 37 times 2.2. And then I divide it by 25. And I've had students say, well, why can't you divide, then multiply? Well, I used to do it that way. That's the way I've always done it. But when I started doing this all the time, I taught pharmacology for many years. So I was doing a lot of dosage calculation. What I found is sometimes the number that you get will have to be rounded. So it's better not to have to do an extra step. So it's better just to multiply 37 times 2.2. And I always check it twice on my calculator. 7 times 2.2. And I got 81.4. Did anybody else get that? And we're going to divide that by 25. And we got 3.256. Now, once you get the answer, go back and look at your question. And that question says, record your answer to 2 decimal places. So it's going to come out. We had to round that 6 became 2.5 became 2.6 because the 6 next to the 5 was greater, 5 or greater, so it made that number bigger. Okay, that's a little bit trickier, only because there's weird numbers of how much fluid's in there. Now I'm going to do one more and then you're done for tonight because I want you to see how easy it is to do heparin. Heparin, Pitocin, insulin. Oh my goodness, all those things that have units sitting there, right? Well, let's do this one. A client, number 11, a client is prescribed 1,300 units. Well, wait a second. That's prescribed. That's an order. That's a deliver. This is a dose. So what is my dose? Prescribed 1,300 units. The nurse has available, well, that's what I have my available is 25,000 units, and the quantity is 500 mLs. All right, so our dose, 1,300 units. And we have 25,000 units, and it came in 500 mLs. So again, units gets crossed off. I'm left with ml, so I know that's going to be my answer. I'm going to multiply 1,300 times 500. Do the top, divide the bottom. And again, I always do it twice to make sure my hands didn't hit anything crazy. I got 650,000 divided by 25,000. And my answer is 26, and that's the answer. Did that help anybody tonight? It's an easy thing. Math is not hard. If anybody wants more help than that, make an appointment before the exam. Go through the handout I gave you. If you can do it, you're good. But if you need help getting that answer, make an appointment, come see me, and I can help you get every math question correct. Okay? Have a good night, guys. Figure out what pediatric assessment you want to do. Next week after the exam is a great week to start your paper, or else week 8, you're going to be up to here. So mark my words. Next week, figure it out. What do you want to do? Pick something. Have a good
Thank you.
night. My pleasure.